Both parties, we have been working to find a path forward that balances the health of our members and our duty to the public to look out for their interests. Today, we are announcing that on Wednesday, March 18th, we will be adjourning sine die with plans to come back in the last week of May for a special session to pass any remaining critical legislation. In addition, we are announcing that we will be establishing the Joint Committee on the COVID-19 response, which will monitor the effects of the COVID-19 virus in Maryland and advise the General Assembly in our role as a co-equal partner in government in oversight in lawmaking roles. This was not an easy decision to make and was made in consultation with public health experts and lawmakers from both parties. We will remain working for Marylanders through Wednesday. We are taking steps to ensure transparency throughout the rest of the session. In the Senate, we are working to video stream floor sessions and voting sessions, which we would not have normally done. We know this situation is not ideal for any of us, but we are doing our best to ensure open government in this time of a public health crisis. We will be essentially condensing the last month of session into 3 days with a third of the staff. This is going to require us to focus on the most important and prioritized policies. That said, we will not stop working on behalf of all Marylanders as an equal branch of this government. United, collaborative leadership is not tested when times are easy. It's at times like these that we demonstrate who we are as a people. I feel more confident today that our state will be strong because I have watched over the last few weeks how senators and staff have found every single opportunity to become more collaborative, put partisanship and titles aside, and work for the people of this state. I'm incredibly honored to lead this chamber where we get the work of the people done. I look forward to the continuing work that we will do throughout this crisis and beyond this crisis. Thank you all, and would like to pass it over to Madam Speaker.
This is a critical time in our state's government and a fragile moment in our effort to secure our state's public health. As we face a now global pandemic, it's more important than ever for us to balance fulfilling our constitutional duties and protecting the health of every single resident. The decision to adjourn didn't come lightly, but we have to make it an informed, research-based decision. There is a lot we don't know about this virus. What we do know is that public health research shows the more steps we can take right now to prevent transmission, the better off we are. As state leadership, we want to set an example for our local governments and neighboring states and do our part to help mitigate the spread of this virus. President Ferguson and I stand united in our support of the governor and his efforts. We are working with House and Senate chairs to prioritize legislation in each committee. In addition to the budget bills, however, I want to emphasize that we will continue to do the work of the people until we adjourn on Wednesday. The people of Maryland elect members of the House and the Senate to work on their behalf each year. Although this year is a little unusual, we are committed to fulfilling our responsibilities even in an unusual schedule. We'll also watch closely what happens at the federal level and stand ready to assist the governor and do everything we can to help the administration manage this crisis. This is a critical time in our state's government and a fragile moment in our effort to secure our state's public health. As we face a now global pandemic, it's more important than ever for us to balance fulfilling our constitutional duties and protecting, excuse me? Okay, all right. I will stop talking now and turn it over to our minority leader of the House, Nick Kipke.
Thank you, Madam Speaker. I know there's an incredible amount of anxiety among all Marylanders, and we share that anxiety here in this room. But I have to tell you, when we face a common enemy, we all pull together and we take care of what needs to get done. And our common enemy is this health crisis. So my message to Marylanders around the state is don't panic. The legislators in this General Assembly with the governor and the administration are working tirelessly to bring forth the resources necessary to address this crisis. There's an enormous amount of concern for our family, our neighbors, about their health. And health officials, in collaboration with the state of Maryland, are working tirelessly to ensure that we are prepared for what might come before us. There's an enormous amount of concern as it relates to whether or not people are going to get paid, whether or not businesses are going to stay open, and whether or not employers are going to be able to stay afloat for however long this lasts. I want you to know that collaboratively, Democrats and Republicans, with this governor and the administration, we are urging that all resources be made available, and we're taking action today. At times like these, it's important for all of us to know that we must pull together, stay calm, and know that we will get through this together. So I support the actions of the leaders of the General Assembly. Collaboratively, we are going to get legislation passed to bring forward the resources that we need to address the coronavirus. We're going to get a budget passed that brings forward resources that we need for the state and to address the crisis, and we're going to be supporting the administration every step of the way. Thank you. And next we have the Senate Minority Leader, J.B. Jennings.
Well, thank you. As Nick said and the previous speakers, we're in scary times, but we will get through this. There is no doubt. We have had scary times before, but we as a nation, as a state, have come together and gotten through it, and that's where we are now. Session will be ending early, which is, I believe, the first time since the Civil War. But it's being done so that we can get our priorities set here. We're triaging legislation, making sure what we pass is going to have direct impact with making sure we get through this crisis. The budget will be passed, the capital budget will be passed, as well as emergency legislation dealing directly with the coronavirus. I'm proud to have worked closely with the Senate President and my colleagues in the House, to come to this, consensus that, hey, it's time for us to wrap up, finish our work here. It's times like this that we come together as one Maryland, and that's where we are. We may be Republicans or Democrats, but today we are all Marylanders, and we're going to get through this. So I stand side by side with my colleagues at a safe distance, social distancing, to work through this and get us to the other side. So thank you.
Questions? What has changed since last night when everyone seemed pretty convinced that there was going to be an effort to try to make it to April 6th? What's changed since then to get us to this announcement?
I think that this has been an evolving situation from day one. This is something that Maryland has not seen before. And from the beginning, we were being advised by public health experts, public policy makers nationally who were providing advice. And it's clear that the faster and more united we are to stop the spread of the virus, the better off we will all be. And we believe this is in the best interest of the state of Maryland and for the members of the General Assembly, but most importantly, the public.
Why did you pick the end of May, sir? Why the end of May for coming back?
We want to give enough time for the public health crisis to move past, and we think it's the appropriate time to close out some loose ends.
So you've been advised through the medical community that that's realistic?
We hope so. I mean, I think this is an evolving crisis. We hope that it is less than that, but we believe and hope that that will be sufficient time to make sure that we can monitor the appropriate recovery.
In addition to the budget, what other items are still on the table that you all consider a priority?
There are a number of issues still out there. We've talked about education issues that we've been working for nearly a decade to figure out. There are are issues around the HBCUs and the lawsuit that's been related that will be in the Senate today. We are looking a lot of local counties and local jurisdiction, local issues that have to get done. There are boards of the physicians that would go away if we didn't work on emergency legislation. So there are a variety of things, the topics of legislating that we deal with on a daily basis here that have to get done. And so over the next 3 days, we will make sure that those do get done.
Will the calendars
Do you wanna
that
add
are brought to the floor be limited to just those issues, or are you going to continue to move through other items as well?
We're going to focus and prioritize, but we're going to continue to legislate. That's why we're here, and we're going to do the work of the people of Maryland until we adjourn on Wednesday.
So time on the floor won't be limited based on the priority of the bill?
We're still the Senate of Maryland and the House of Delegates of Maryland.